Phosphorus meats for CKD patients. Living with chronic kidney disease or CKD can be challenging, especially when it comes to managing your diet. One key factor CKD patients must monitor is phosphorus intake, as excessive phosphorus can lead to serious complications. Phosphorus is found in many foods, including red meat, which can be hard to avoid, but it is a little high in phosphorus. This is why following a renal diet that limits phosphorus-rich foods is essential for managing CKD and promoting overall kidney health. Luckily, there are many lower phosphorus meats that can be enjoyed by CKD patients without compromising their health. With proper planning, it's possible to include delicious low phosphorus meat options in your diet. These choices allow for a variety of tasty meals while maintaining good kidney health. By carefully selecting meats and pairing them with kidney-friendly ingredients, CKD patients can continue to enjoy flavorful dishes without overloading their body with excess phosphorus. You might be wondering about who I am and why I'm qualified to talk about this. If you're someone living with chronic kidney disease, I've got great news for you. Hello, I'm Mathia Ford, a registered dietitian nutritionist specializing in chronic kidney disease and owner of renaldiethq.com. I specialize in helping people just like you improve their health by making simple yet delicious changes to your meals. Together, we can transform your eating habits, boost your overall well-being, and ensure that you're enjoying every bite along the way. Say goodbye to bland and boring meals and say hello to a healthier, more vibrant life. Let's get started on this incredible journey to better health together. Visit renaldiethq.com today and take the first step towards a healthier lifestyle. Why low phosphorus with CKD? The kidneys are vital organs that help maintain balance in the body by filtering out unwanted substances from the bloodstream or excess substances in the bloodstream, including phosphorus. When too much phosphorus accumulates, it can lead to serious damage, not only to the kidneys, but to other vital organs. For individuals with chronic kidney disease, carefully monitoring phosphorus intake is crucial to prevent complications. Elevated phosphorus levels in your blood can trigger the release of parathyroid hormone, leading to mineral imbalances that weaken bones and joints, increasing the risk of fractures. Additionally, high phosphorus levels are linked to cardiovascular issues like heart disease and artery calcification, making it essential to manage dietary phosphorus carefully. A low phosphorus diet is key for CKD patients to reduce the risks associated with mineral imbalances. While fresh fruits and vegetables can provide essential nutrients without excess phosphorus, choosing the right meats is equally important. Understanding which meats are lower in phosphorus allows CKD patients to enjoy a variety of protein-rich foods while supporting their kidney health. By carefully selecting meats that are low in phosphorus, individuals with CKD can maintain a balanced diet and ensure your kidneys stay as healthy as possible. Let's talk about where you can get dietary phosphorus. It's crucial for people with CKD to carefully monitor your dietary phosphorus intake if you're elevated levels in your labs. Many common foods such as meat, fish, dairy products, nuts, legumes, and whole grains are high in phosphorus and can elevate blood phosphate levels if consumed too frequently or in large amounts, especially if your kidneys are damaged. These foods also contain calcium, which when paired with excessive phosphorus can lead to further complications in your bones. To maintain a low phosphorus diet, it is important to read food labels carefully and compare different brands or types of similar products. In some cases, healthier alternatives such as snacks with lower phosphorus content can be found, helping CKD patients manage their phosphorus intake more effectively. Phosphorus is not listed on the food label, though that is a problem. For those seeking low phosphorus meat options, there are several suitable choices that provide protein without overwhelming the body with phosphorus. These include chicken breast with the skin removed, freshwater fish like tilapia and canned tuna in water, turkey breast cutlets without the skin or fat, extra lean ground beef, pork tenderloin medallions, and peeled shrimp. These meats can be incorporated into a balanced diet to support kidney health while reducing phosphorus consumption. CKD patients should always consult with their dietitian before making significant dietary changes to ensure your meals meet your specific health needs, offering both nutritional benefits and a peace of mind. Factors affecting the phosphorus levels in your food. Maintaining low phosphorus levels is crucial for people with chronic kidney disease, as excessive phosphorus can cause health issues, as we've already discussed. Certain foods naturally contain high levels of phosphorus and should be significantly reduced or tended to in your diet, especially if you have elevated levels in your blood. Various factors can influence how much phosphorus is absorbed by the body. For instance, cooking methods such as boiling, steaming, and baking are considered the best for reducing phosphorus content because they preserve the nutritional value of the food without significantly increasing phosphorus absorption. Other factors that affect phosphorus absorption include food processing techniques. Refined and processed foods like cereals often contain higher levels of available phosphorus due to the milling process and additives, which removes the bran layer and releases more phosphorus. Additionally, preservatives added to packaged foods can contribute to extra phosphorus, making these items less suitable for CKD patients. For those on a low phosphorus diet, medications like phosphorus binding drugs can also help reduce phosphate absorption while used alongside a careful planning of your diet. By understanding these factors and monitoring phosphorus intake, CKD patients can make informed decisions and enjoy meals without the risks of complications from excessive phosphorus. A diet rich in phosphorus can place significant stress on your kidneys, so it's important for CKD patients to monitor your intake carefully, especially if you have elevated levels in your blood. Meat is often high in phosphorus, but there are still plenty of low phosphorus options that can be safely included in a CKD-friendly diet. For example, a 3-ounce serving of beef pot roast contains 155 milligrams of phosphorus, while skinless chicken breast has about 190 milligrams per 3-ounce cooked portion. Other low phosphorus meat options include lean ground beef with 170 milligrams of phosphorus per 3-ounce cooked portions, and various fish such as canned tuna, mahi-mahi, and shrimp, all in 3-ounce cooked servings. Other meats like turkey sausage, beef jerky, and pork rinds also provide essential nutrients while keeping phosphorus intake lower. While many meats are naturally higher in phosphorus, choosing these lower phosphorus options allows CKD patients to maintain their protein intake without overloading their system with excessive phosphorus. These meats are also rich in beneficial vitamins like B12, zinc, iron, and thiamine, supporting overall body functions. Even with phosphorus limits, patients don't have to sacrifice flavor or enjoyment in their meals. Using low sodium herbs and spices and pairing meats with kidney-friendly side dishes such as vegetables and fruits, CKD patients can create satisfying and delicious meals. With careful planning and portion control, that's the difference. When you reduce your portion of meat, you get less phosphorus. It's entirely possible to enjoy a varied and flavorful diet that supports kidney health. Reducing your protein intake overall helps you reduce your phosphorus intake. As mentioned, cooking methods play a crucial role in reducing phosphorus levels in food, which is particularly important for people with CKD. Techniques like boiling, steaming, and stir-frying meats can help lower their phosphorus content, as these methods use minimal oils and fats. Boiling and steaming are especially effective as they allow the phosphorus to leach out into the cooking water, which can then be discarded. Stir-frying while using a small amount of oil is another good option as it minimizes calories and fat. Additionally, broiling or grilling meats without excessive fats can also be beneficial, providing flavorful meals while keeping phosphorus levels in check. When seasoning, opt for herbs and spices that are naturally phosphorus-free, such as garlic powder, oregano, basil, paprika, and cumin. These add great flavor to dishes without contributing to phosphorus intake. For salads and sandwiches, consider using phosphorus-free dressings like lemon juice or vinegar-based options to enhance taste without raising phosphate levels. It's also essential to be cautious with store-bought meals, as many processed frozen dinners and deli meats often contain higher levels of phosphorus. You got to check that in the label, in the ingredients. By choosing fresh produce and carefully reading ingredient labels, CKD patients can ensure their meals remain low in phosphorus while still being flavorful and satisfying. So you're looking for PHOS in the ingredient list. That means it's added phosphate. So there's some alternatives. There are many delicious and nutritious alternatives to meat for patients with chronic kidney disease who do need to lower their phosphorus intake because their levels are elevated in their blood. Vegetarian meals are an excellent option for obtaining essential nutrients while being mindful of dietary restrictions. Legumes such as beans and lentils offer a good source of protein without the fat or cholesterol found in animal-based products. Whole grains like quinoa, oats, and brown rice are also great additions, providing energy and essential vitamins in a kidney-friendly form. Additionally, nuts such as almonds, walnuts, cashews, and pistachios are rich in omega-3 fatty acids, which can help reduce inflammation, a common issue in CKD. Eating non-meat sources of protein doesn't mean sacrificing flavor. Many creative and flavorful recipes like eggplant parmesan or tofu stir fry can add variety and excitement to meals. These dishes provide a fresh twist on traditional favorites, ensuring that people with CKD can enjoy meals that are both satisfying and beneficial for their health. By incorporating plant-based proteins, grains, and nuts into the diet, CKD patients can not only meet their nutritional needs, but also enjoy a range of tasty options that support kidney health. A low phosphorus diet is an effective way for CKD patients to manage your phosphorus levels, reducing the buildup of phosphorus in the body and ultimately helping to alleviate symptoms and improve overall health outcomes. Limiting animal proteins like red meat, poultry, and fish is one of the primary strategies for reducing phosphorus intake. In some cases, medical treatments can also be used to lower phosphorus levels if necessary. However, it's important for individuals to consult with their healthcare providers or dietitians before making any significant dietary changes to ensure that these adjustments align with their specific health needs. For those looking to maintain adequate protein intake while keeping phosphorus levels in check, plant-based options like quinoa and beans can be valuable additions to the diet. These vegan sources offer essential nutrients without the high phosphorus content found in animal-based proteins. Non-vegans can also explore low phosphorus meats, which provide protein while still helping control phosphorus levels. By incorporating these dietary changes, CKD patients can improve both their health and quality of life, finding a balance that supports their kidney health while still meeting their nutritional needs.